Hello and welcome to this very short but stimulating conversation on trans fatty acids. Dr. Shauna Dons, Assistant Professor, Department of Urban Global Public Health at the School of Public Health at Rutgers Global Health Institute. I hope I got that one right, Dr. Don. Let me just start off this question by asking you that, do you think this pandemic is going to lead to an increase in the consumption of trans fatty acids, particularly in the developing nations?
That's a really great question. I think with all things related to COVID, we don't really have all the answers. So although we don't know yet whether or not it will increase trans fat consumption, we do have some information from other shocks that could inform what happens related to trans fat in relation to COVID-19. So for example, we know from environmental shocks, such as natural disasters or also extreme weather events, that post those events, there is a tendency to eat poor quality foods because those tend to be more affordable. And so in the context of trans fat, we know that from data around the world that trans fat containing foods tend to be cheaper than their non-trans fat containing counterparts. So that's one aspect of it. The other is post shocks, you tend to eat more processed foods as well. So trans fats are obviously in a lot of processed foods. And so there's the potential there to increase intake. And then lastly, when we think about some of the benefits of trans fats from a food processing perspective, they tend to have a longer shelf life. And so right now with COVID-19 and some disruptions to food supply chains, it might actually be easier for food manufacturers to be using trans fat in their products because the shelf life will be longer. The problem with this is that it's going to affect the lower income populations the most. So you might see, as you mentioned, in developing countries or low and middle income countries, an increase in trans fat intake. But the short answer is we don't really know the answer to that question. The possibility that it could lead to increased intake.
Okay. You mentioned that because trans fats is more easily available at a time, particularly during a pandemic and stuff. Do you think one of the reasons why there is difficulty in sort of switching over or eradicating trans fats from the global food chain is partly due to the fact that the other alternatives are slightly more expensive?
Yes, I think that's a big component of it. And I think, in the US and Canada and European countries, it's actually been shown to be pretty affordable to switch over from trans fat to other oils, with the exception of bakery products, which are a little bit more challenging in terms of product reformulation. But still in that case, there's this transition towards using palm oil, which is cheap and widely available. So the cost component is really important. And particularly, again, when you're thinking about low-income populations around the world, when you ask people what drives their food choices, it's affordability. That's the main thing. And so if we have products on the market that are cheap but lower quality, people are going to have to make that trade-off between quality and price. And unfortunately, it means sometimes consuming foods that aren't the highest quality.
My last question, I know that I sort of hounded you to come in early this morning from your end to do this. My last question to you would be that, do you think it is possible that because of this pandemic, a lot of nations, particularly the poorer nations, might use that as an excuse to sort of, not abide by the 2023 WHO deadline? Is that a possibility? Have you seen anybody doing that already?
So again, that's a great question and something that we don't know the answer to yet. What I do think is that definitely, resources, prioritization is all going to be put into the pandemic and how to cope with it and how to battle it. And so there is the possibility that that prioritization for trans fat reduction kind of goes down the ladder. So that's problematic from the private sector as well. So from a regulation standpoint, it might not be prioritized at the same scale as it was before. Then when we think about the private sector and some of these small informal manufacturers that maybe don't have a lot of capital and don't necessarily have the funds to invest, or it stretches them a bit more when they're trying to invest in terms of reformulating their products to reduce trans fat. For those companies, it might be even more challenging because they're already in many cases being stretched economically. So that might be more of a disincentive to not reformulate their products. But again, we don't really know. But that's just that's my guess, essentially.
What is your sort of, your thoughts on the possibility of that happening? That people might actually use it to push it and say that, because of the pandemic, could you push the deadline a bit more or something like that? Has anybody ever reached out to the WHO yet on that?
Yeah, I'm not sure. I feel like the WHO at the moment has so much on its plate and is so underfunded that, that might not be on the radar at the moment. The thing with health and public health is that whatever is in our face at that moment is really what is prioritized, because health ministers are driven by their constituents, and so the people around the world, we're all worried and thinking about COVID-19, and so I think the emphasis is definitely put on that. And so I don't know what will happen in terms of the Replace initiative. I'm fairly certain that they're going to continue to push forward and really try and get countries to reduce the trans fat levels of their food supply. But whether or not that will be the priority for given countries is uncertain.
Last question before we sign off. I know I'm pushing it, but please bear with me. The thing is that, a lot of countries, particularly India, for them, the priority has always been sort of elevating hunger, poverty, and things like that first. And trans fats is not really seen as that sort of high on the priority list. Would that be the correct way to go, or do you think it is as bad as trying to tackle poverty and trying to tackle hunger?
I mean, the thing is that they're very much interlinked. So I mentioned before that low-income populations tend to be the populations that are consuming higher quantities of trans fats because those foods tend to be more affordable. Those people are also more likely to have forms of malnutrition. So it could be, micronutrient deficiencies or stunting, that type of thing. But at the same time, overweight and obesity are also increasing in those populations. So it's not an either or. I think that we really need to focus on the quality of diets overall for all populations, whether the number one contributor to disease is undernutrition or if it's overweight and obesity. And so, for both of those forms of malnutrition, having a high quality diet is really what will prevent them. So I think that's, especially in the context of India, there's also, increased risk of diabetes. And so you might not be overweight or obese, but still have a risk of diabetes or other diet-related non-communicable diseases. So ensuring that we have a healthy diet is really important. And actually, when you think globally, the number one risk factor related to the global burden of disease is diets and poor diet quality. So we really need to focus on that to try and address all these different forms of malnutrition, but also diet-related diseases as well.
Great. Thank you so very much, Dr. Downs. I really appreciate this. You're taking time out on this. And, I'm really grateful.